I'm Dr. Ehsan Garjadaki, and today, as usual, we have said for Thursdays, 5 p.m., I have a live section on different mental health issues, and we are still focusing on personality disorders and issues with personality disorders. So if you have any concerns, if you have any questions, comments, etc., you would like to share, please feel free to do so. You can post it on our channel and as a comment, and I can address those. I will get those in front of me and I will try to address them. So today what we would like to focus on is the role of codependency in increasing stress, especially as it happens around the holiday time. Around holidays, stress can get to us, and then with codependency, with more codependency, we will not have a good time, going through this stressful situation. And in fact, it increases our stress. And if we can move from codependency to self-differentiation, it allows us to reduce stress in our lives and live life in a much more peaceful way. So in order to do so, we really have to understand codependency and also the concept of self-differentiation and how they differ from each other, and then how to move from codependency to self-differentiation. So let's start with that. What is really codependency? And as a general term, we also understand that codependency is unhealthy. It's regarded as a quite unhealthy level of connecting and depending and attaching oneself to other people, and at times even objects, but mostly human beings, and even perhaps sometimes animals, pets. But what is it really? What is unhealthy about it? What is that function of codependency? So basically, I can give you an example to quite clearly understand the dilemma here, or the dysfunction, if you will, and the ineffective nature of codependency. So usually, you may hear something like, or observe some kind of an interaction between people, whether it is between yourself and people who are in your lives, or you see it between two different people or even multiple people within your circles. And it goes something like, one person tells the other person that, what you did made me sad, and or angry or upset, and so forth. And beyond just expressing this fact, simple observation and self-expression, they also engage in certain strategies. It could be verbal, non-verbal, interactional strategies that make the relationship very much conditional and contingent, especially as it relates to one person's feelings compared to another person's actions. So basically, the follow-up on what I just mentioned to you earlier, in terms of expression of one's pain that is linked to another person's behavior, would be a certain condition that is now put on the relationship, meaning that a certain demand, this expression moves into a demanding position with something like, you better stop doing what you're doing, or a certain punishing action will take place, or a certain unpleasant event will occur, such as, I could say something like this to my partner, saying, it pisses me off whenever you talk about, my in-laws, and you always talk negatively, etc. If you can't stop talking negatively about them, then we don't have a good relationship. Then we don't have a marriage. Then I can't love you, or I can't respect you, or cannot, um, or I won't talk positively about your family and your parents or siblings, etc. So that's that condition that follows the first expression of the pain experience. So now, generally, I think most of you probably would think this is a good thing, or would think that's a kind of just kind of common language and common strategy and common human need, and it's acceptable, and generally people engage in these sorts of really conditional negotiations, and it's really acceptable. It's just a daily common experience. But that goes to show how ingrained codependency is within relationships. Because if you think about it, there is no necessity for this kind of a contingency. There is a solution out there instead of contingency and conditional living and responding to one another. And that solution is called self-differentiation. So what does it look like? Let's kind of, first of all, understand that and define that, and then compare and contrast. So self-differentiation, first of all, is more or less defined by a person's ability to accept one's self, their own real internal world, and their own unique way of being in this world, and so basically both internal and external existence, preferences, biases, choices, as well as respecting other people's preferences, biases, choices, experiences, and being able to get along with them. So rather than jumping to polar opposites of the spectrum of interactional effectiveness, meaning or ineffectiveness in this case, gravitating toward one pole, which would look like disowning the other person, completely separating oneself from the other person, and never wanting to see them again. And the other pole, complete opposite of the spectrum, which would be really a very passive giving in to the wishes and needs and desires of the partner, and losing oneself in the relationship. Instead of jumping to one of these two polar opposite poles, a self-differentiated person remains in the relationship, doesn't completely lose themselves and give in, and also doesn't completely forget about the relationship and get out. So they're willing to live with the discomfort, but because there is a benefit, not because they're masochistic and they want to hurt themselves and they enjoy pain, but because there's a greater benefit to have. And that greater benefit is growth and maturity and long-term gratification versus short-term satisfaction. Meaning that, if I act from a self-differentiated position, then my response to my partner would be quite respectful, assertive, firm, but also understanding and caring. So let me give you this example. If my partner tells me, the way you talk about my, or my partner tells me something about my in-laws, their in-laws, which is basically, let's say, my parents, and I don't like it because it's negative. So rather than coming from this codependent, contingent and conditional perspective where we tell them, oh, you better stop or we don't have a relationship, a self-differentiated response would go something like, okay, I see that you have your opinion about my parents. You don't like the way they clean their home. you don't like their environment, their living standard, and it doesn't match you. And I get that. You're a different person. You grew up differently. Your standards differ from my parents' standards. And you're entitled to your own preference and bias and choice, and you may like it or not like it. Now, I personally um, like it. I personally like my parents and the way they live. I respect them. I appreciate them. I don't get involved. I don't pass judgment on how they live, whether they, are organized or clean up their home or not, and live a germ-free life, whatnot. I don't pass those judgments on them. I kind of stay away from that type of a judgment. I relate to them from a different perspective. So I can't really agree with you or disagree with you. Um, I may be leaning toward more disagreeing with your negative judgment, or more focus on only this aspect of my parents' existence and relationship, and not looking at their other aspects of being loving, caring, happy, very responsible individuals, intellectual, and this and that. But so be it. You have your opinion. I'm not sure if you change your opinion or not. I can acknowledge that you have your opinion, but don't expect me to agree with you or get on the same bandwagon with you, because literally my focus is different, and that's it. I would be a self-differentiated response. I would not make the longevity and continuation of my relationship with my spouse conditional or contingent upon her changing her behavior or her opinion or her likes and dislikes. I would not do that. I would just acknowledge it and move on. Meaning, that's what we call with self-differentiation. Like two entities come to a discussion of an event. They recognize that event. They recognize their differences, and they move on. They don't completely zap out of the relationship and discard the relationship, and they don't also, against their own personal wishes, give in to the other person. So another example for a codependent response would be something like, for fear of upsetting the partner and the spouse, or for fear of perhaps the upset, negative spouse leaving the relationship or finding even further fault, not only with my parents but also with me, quickly agreeing with them and say, yeah, I have always hated this about my parents. They're so dirty. You're right. And then how dare they? It's like I hated it about them. And you know what? This just sucks. And you're completely right. And at least somebody understands me. And if it is fake, it's problematic. If it is not fake, if that's truly how a person feels, they truly have hated that aspect about their own parents, okay, so be it. Now they happen to be on the same page, but they're not changing and faking and pretending their agreement and basically like-mindedness with their spouse, because they're afraid, if I don't do that, my spouse will leave me. So now, that's maybe difficult for many people to digest and grasp, in terms of, well, how can I, just kind of live side by side with a partner that I completely disagree with, or we have different preferences, we're not on the same page. And that really brings up the underlying core issue, the hidden problem with codependency, and that's why it's called codependency. Meaning, why not? the reason that a person would go so far as to state that their requirement for their happiness in a relationship is particularly similarity between themselves and their partner, that's very much a very highly dependent when we call an enmeshed um, type of an existence, meaning that um, a person's likes and dislikes, preferences need to match that of another person for them to feel gratification. So rather than appreciating their own individual, unique values in and of themselves, they are incapable, if you will, or unwilling to appreciate their preferences in their singularity or by themselves. These values that they harbor have to match other people's values and vice versa. So the matching becomes much more important than the preference itself. And it's kind of contrary to how a human being, what a human being is, exists for. If you think about it, we are not conjoined twins, neither physically nor psychologically, with other human beings, especially not with a spouse, or even again children or parents. You're not, joined at the hips. That's not how we come to this world and leave this world. The whole purpose and again nature and reality. It's the reality of the facts of human existence is that every human being, at least for 99.99% of the population, except for real conjoined twins or conjoined siblings, most people in the world are born into this world as single entities. They're one person, they're not two people. So a person is born into this world as one person and leaves this world as one person. So literally, both in terms of this psyche and the body, and in fact even the soul, if you believe in that, we really fulfill our purpose and match the reality of our existence if we realize that our life from birth to death is defined by our singularity or soul entity, right? There's one person who is responsible for himself or herself, who experiences the world for himself or herself as one individual with both a physical skin, if you will, as well as a psychological skin. There is one skin around us that basically contains this body and separates us from members of the society and the environment, as well as psychologically, a psychological skin that we liken to more or less our self-identity, self-concept, self-worth, specifically the self-concept, and that is also separate from other people's self-concept. So within that, we have the right and opportunity and the safety and protection of being unique and having our own unique composition of feelings, of preferences that very well are diverse from other people, and they are not contingent upon matching to other people's desires and preferences and biases. They're supposed to be quite different and diverse, and basically very much, and that's what makes it a unique proposition, a unique composition of all these millions of likes and dislikes and preferences, and that basically make up the identity of this person. If we come to believe in its right to function as that soul entity and function along with other soul entities on a unitary human beings around us, then we understand truly the necessity for self-differentiation and the fact that we have to let go of codependency. A codependent relationship, has only a limited benefit, and that is more or less as, if you will, a crutch or a scaffolding, a support system, while we are immature and little and weak and need the support. So as infants that we come into this world, and kids, toddlers, uh, you know, teenagers, up until really around 16, 17, 18, maybe maximum 20, 25. That's it. Because at 25 years of age, maximum, all our faculties and aspects of our existence have grown to its full extent, whether it is cognitive abilities, emotional intelligence, interpersonal skills, social skills, brain growth, body growth, physiology, hormones. Everything is functional, developed, it's working in its optimal capacity. Certainly, we're missing experience and wisdom and resilience to some extent, and perhaps some certain positions and social values, and like authority or career and so forth. But otherwise, we are quite capable as fully developed individuals. So if we are such human beings that function this way, we only need the scaffolding and support and crutch from birth to right around about the age of, let's say, 18, and that's probably the reason why age of minority versus majority has probably been determined at 18. Because generally people have developed enough of all these categories that we mentioned, enough resources internally to simply exist as a single, independent human being and achieve anything they want in life. So if that's true, then we have to be able to also outgrow this scaffolding, to kind of shed that skin and or that support network around us and rise above it. And which means that when it comes to specifically relationships, we have to be able to transition from a codependent relationship and concept of being in relationship with other people to a non-codependent or healthy interdependent, as well as what we call a self-differentiated state of mind and of relating to others. And as a result, we will really end up benefiting immensely from self-differentiation, because what happens is that it provides, respect for diversity, respect for partners, for people in our lives. It gives them some of both ourselves and themselves a space and time and opportunity to grow independently and kind of safeguard and maintain our unique individual selves, while still remaining in a meaningful, healthy connection with others, which we call relationships, and also promotes a fertile ground for further development of and strengthening of unique propositions and characteristics, and also, I would say, provides for a quite empowering strengthening of each individual, because basically helps the confidence and the effectiveness and the self-efficacy of each individual to feel that they're being validated in their unique journey, and they're not being rejected or abandoned or shunned. So there's less of an obstacle, if you will, rather than more. So that's kind of the paradoxical benefit. Like, people get into codependent relationship because they desire the approval, the validation, that support, and the communion, or the company, and the constant reflection and mirroring. However, they actually in reality not providing it because there's a huge demand on similarity, versus a self-differentiated, a truly self-differentiated recognition of oneself and others would allow for a true sense of validation and support and acknowledgement and continued mirroring and healthy reflection, and therefore a call and a um, and an approach, and a very self-supportive approach for others to confirm who they are in themselves and by themselves. And again, learning how to respect this proposition where people can be unique while connected. They can be unique while appreciative. They can be unique while helpful. They can be unique while caring. It's very counterintuitive, but only because our cultural upbringing and values are generally formed in such a way that people are not informed and educated about these more deeper psychological values. So most people are just busy living a life. They don't have the luxury of really examining and analyzing their lives and getting to the root causes and issues, understanding their lives and what is happening to them, the source causes of some of their anxiety and mood fluctuations and failures and successes and impact they have in relationships, or how they are being influenced and impacted by others. So therefore, the most of people's attention really goes toward these more immediate needs, where people are kind of eager to solve problems now versus live with problems and find long-term solutions. So over time, they would gradually transition into a more peaceful life. They want peacefulness right now. And that's part of the actual problem. And so going back to very much contrasting codependency with self-differentiation, we see that with more self-differentiation, even though it is harder to implement in the beginning, with more self-differentiation, we will have a lot more, both individual as well as collectivistic or collective benefits for everyone. And with more codependency, we will have a lot more rigidity, a lot more contingency, a lot more unhealthy dependence on one another. And basically, it stifles growth and development and healthy function. And ultimately, creates a bind between people, where people are, if they feel that bind, that they can't get out of it, such sense of imprisonment, versus liberation and freedom. And so now when it comes to holidays and stress, we will have a lot more on our plates to deal with stress to holidays. There are time deadlines that we have to meet. We are coming to the end of the month, to the culmination of, let's say, especially now, festive holidays around Christmas and New Year, and ending a fiscal year or calendar year, and then beginning a new one. And certain New Year resolutions, goals that people have set up for themselves. Psychologically, there is a huge transition from kind of the old to the new. And therefore, throughout the multiple tasks, goals, deadlines people have set for themselves and others, especially with, let's say, more complex families where multiple people are involved and multiple needs and desires need to be met, then that tendency to want to make things happen leads to a little bit more of an immediate engagement in codependent relationships, making things more contingent and conditional, getting more upset about things that don't go one's way despite having set those expectations, and things kind of going broke more often than not, instead of getting fixed. So as a result, its added demand of the stressful events and deadlines to meet and goals to obtain and achieve, our tolerance is reduced, and we have much more probability to kind of develop a short fuse, impulsively react, rely heavily on our feelings in the moment because we got upset in this situation or that situation, and therefore take that feelings of whether it is nervous, anxious, upset, agitated, disappointed, lonely, whatnot, to the next level of some kind of a meaningfulness. Like, okay, because now this is happening and it is around this important holiday season, therefore it means that something drastic needs to happen in my life, like questioning, let's say, a relationship, a major decision that a person has made, or kind of shying away for wanting to follow through with a major decision that they have planned for a while. And suddenly, based on these momentary feelings, develop certain doubts about going through with those decisions. So we need to realize that we literally have to rely more heavily on our really built-in values, such as patience and tolerance, and again a acceptance of diversity, basically freedom, respect for diversity, respect for people being literally different. Not bad, not good, not worse, not better, but just different. Like equal but separate, equal but different. And that's a very important, I would say, value and virtue that every human being possesses, but is downplayed. We are kind of downplaying the value and worth of these aspects of society and human function. So specifically during this stressful time, we need to focus even more on these values, have more patience, have more tolerance, almost forcefully leading ourselves toward that. And I guarantee you that you see a lot more benefit coming out of this. So now we have getting some questions. Lindsay asks, what do you do when you go through a traumatic event and can't move forward? Can't get images out of your head and blaming yourself? Nothing helps except alcohol. Good question, Lindsay. Thank you for posting that question. And basically, there are two components of this. First of all, what do you do with traumatic events and seemingly can't move forward? And the second part that's really links to the first part and it also leads us to the solution is the problem with getting images out of one's head. And we can't really forcefully do that, and we're at a loss of tools, techniques of doing that. And the only thing that some people, at least in this case, is stated that nothing would help except perhaps in this case alcohol. And I would bring up other examples that many other people may say, well, perhaps other drugs, perhaps sex, perhaps gambling, perhaps even just compulsive, let's say, sleeping, or even eating. We know that like eating disorders, like bulimia, is associated with this emotional dysregulation. When a person feels emotionally activated, they immediately, they kind of even dissociate. They really shift into a much more, I would say, physiological gratification. And same thing with alcohol. The body shifts into this immediate tool that has taught us that, listen, you want to check out, drink me. Right? Alcohol has taught us that. You want to forget about things, nothing else works for you, I guarantee you, I can knock you out, right? So there is that relationship going on between drugs and all these activities, as I mentioned to you, especially when they're done compulsively and very frequently and basically relentlessly, and our brain. These gambling, sex addiction, alcohol, drugs, eating, overeating, or even purging, even restricting eating, all those compulsive behaviors, they have taught us that they come to our help when nothing else helps, and that's the particular dilemma, right? That's where the powerlessness of at the core of addiction needs our attention. That literally this is a disease due to that sense of powerlessness, that a person feels that they're powerless toward this overwhelming compulsory behavior. So what do we do? Well, you have to really break things down. It's very complex phenomenon. But in this case, I'm just going to stick to, let's say, one of the things that you can do. And in this case, as the example shows, with traumatic images, not being able to get those out of one's head. The idea here is that yes and no. So we have to recognize that, yeah, generally you can't forcefully get it out of your head, right? But leaning on alcohol only as the only solution is part of the problem rather than solution. So this goes to show how rigid a person's lifestyle has become, where basically their only go-to type of a behavior is drinking alcohol to blackout. And the same person would very likely, I bet you, high amount of money, that they would very likely, whether it's $1,000 or $1 million, doesn't really matter. But I can bet that this same person would say that they have been through this blackouts. They have been able to, shut down these images, traumatic images, to using alcohol for a while, but not forever. Right? It hasn't been a long-term solution for them. It only is a short-term solution, and therefore also it becomes more addictive and more damaging and more destructive, because they see that they have to repetitively engage in this alcohol-consuming behavior in order to shut down those images, but the body cannot handle it over time. The liver breaks down, the brain cells die, the other cardiovascular problems, and again physical problems develop, and therefore really it's not a good long-term solution. Yeah, short-term it works, and that's why we gravitate toward them. It allows us for a while to use this technique of basically drinking alcohol. And part of the other reason that it works is because it provides a temporary solution until we are distracted by another life event. And then it fools us into thinking that it actually even works over time. Because let's say we get drunk and then we forget about these images, and then we are distracted by some life event. We have to take care of that for a while. Then again, the images pop up. Then we drown ourselves into alcohol again, and then drown these images. And then some life event happens, and we're busy with that. Then again, after a few months, after a few years, we engage in this alcohol consumption again, and this repeats itself for probably a decade or two. But literally, after trying that a few times, we have to come to the conclusion that this is a terrible long-term solution. So, and it's kind of to be expected from this question too, that the person realizes that there must be something else, right? Am I missing something? Isn't there something else than just alcohol? So there's an inherent covert recognition that this is not the best way. And you're right. Asking this question, you're right that recognizing that there must be other tools available, but it requires openness. I mean, I can list 10 different tools right now. But as long as a person doesn't have openness to trying and experimenting and experiencing these new tools, there is no way out. So what I would suggest is to really be open to try, be open to learn. So the reason there are multiple tools is because people are different. One person leans toward learning things auditorily, listening to things. Another person wants to see things to learn. Another person wants to read things. Another person learns within a relationship, like by being guided by another individual, by a coach, or by a specialist. Another person learns by themselves. So, but there are many tools. Some of the examples I can give is distraction, kind of a almost very routine religious distraction, meaning refocusing, reshaping our attention toward pleasant images, like flooding our system with all kinds of positive images and experiences. Another one is something called EMDR, eye desensitization, eye movement desensitization and reprocessing, has provided good track record for dealing with trauma. Another one is called biofeedback, which is basically a means of using our own bodies and teaching our own body to develop different neural pathways within our system and refocus on that. Is at times there's something called ECT or TMS. Those are more of quite medical, modalities that are used on the brain. The CBT, cognitive behavioral therapy, has at times shown good progress. EMDR, I mentioned that. I'm sorry, DBT, which is basically a dialectical behavioral therapy. It has multiple strategies. It takes about 16 weeks for a person to go through, and literally they learn how to develop new images, shut down these traumatic images. So I would suggest, Nancy, that if you're interested, or someone that you think would be interested, first develop an open-mindedness toward trying, experimenting new, different modalities, researching, believing that there is a solution out there. You're not the only one. Many people have had this experience. I personally have had traumatic experiences in my life, and at certain phases and stages in my growth, I have gone through these horrible times where I couldn't get certain images out of my mind. But over time, I noticed that through growth and development and kind of literally maturity of emotions and thoughts and way of conceptualizing, experiencing, interpreting, reacting to the people and environment around myself, my brain learned how to overcome those images by itself. So the solution is out there. The first step is to be open-minded. The second step is to do research on them. The third step is to try them one at a time, and until you find which one works for you. Just like many people, let's say they want to travel, they try different vehicles. One person, tries cars and falls in love with them and just wants to travel around the world in automobile. Other person may just want to fly only and not drive at all. Another person may love to sail around the world or take a boat. And other people love bicycling or taking a motorcycle. How do you know unless you try that? And you have to try to see which one you don't like, to guide you to the ones that kind of narrow down on the things that you do like. That's just life. That's what it is. If life is trial and error and learning. So next question I have is, and again, thanks Lindsay for asking this question. I hope I was able to answer it. And again, if we're bringing up these questions, you guys don't get the full answer, please post it. I will go through them. I will respond online. Eternal Rhapsody asks, I like it when my girlfriend gives me a derisive look. and I don't understand why my heart skips a beat. My X thinks it's how I try to regain control. Any insight? Okay. And then there's a follow-up question by Lindsay again. So can a traumatic event lead to addiction? So let me quickly answer Lindsay back, because she is kind of related to what I was discussing. And very briefly, yes, and we know that actually one of the core issues, you know, that is discussed within addiction treatment is trauma. So perhaps 80% or more of people who are addicted, their history is full of what we call adverse childhood experiences, especially specific trauma, such as sexual, physical, events happening, emotional trauma happening in their lives. Not always PTSD, but it could be PTSD as well. So basically, some kind of a complex, more well known as complex trauma, that linked to addiction. So really, addiction is more of a masking strategy that has developed. It's a compulsive, very much, almost really just obsessive compulsive dependence on external substances and at times also processes, internal processes that help a person to simply escape reality and escape into an alternate reality where they don't have to feel the pain because they don't have the tools to face that pain. And trauma is pain, right? So a lot of times people with traumatic past, they tend to easily develop addictive behaviors because they come from that traumatic, painful experience, and they have been prone to seek almost like pain mitigating actions and processes more often than people that haven't had much of traumatic and adverse experiences. So going back to, what was it, Eternal Rhapsody's question, I like when my girlfriend gives me a derisive look. I don't understand why my heart skips a beat, and my ex thinks it's how I try to regain control. Any insight? So I'm not sure if the ex is the girlfriend, or this person is kind of using two different words for the same person. So girlfriend or ex, I'm thinking it's the same person, but basically, what's a derisive look? Something like that ridicules a person, right? Derides a person, and conceited and contempt, and and that leads you to almost like it. My heart skips a beat. And so you like it, and your heart skips a beat. So you get an internal reaction out of it when you are being looked at with derision and contempt and ridicule and basically a disapproval. So now, any insight to whether or not X is correct in terms of what this has to do with, like you want to regain control? Could be. I mean, that is perhaps a strategy. I mean, I can see that happening, that you would be kind of very much subconsciously not wanting to be a target and the victim of that so-called attack. If someone is looking at you with derision and generally other, generally in relationships, there's kind of a protocol, right? Subconsciously, consciously, automatically, people react in a certain predictable way to contempt. and to ridicule and so forth. So they don't like it. They distance themselves from the other person. They even revolt against the perpetrator. And so it leads to more of a conflict, commotion, a escalation toward negative interaction. But this seems to be, in your relationship, it seems to be that you're liking it and even getting excited about it, maybe a mitigating factor here to, not, I would say, just to gain control, to regain control, gain control, but perhaps also just simply remain grounded and focused and still keep your position of power or equality, rather than giving in, rather than having to revolt and impulsively react and or further actually self-victimize. Let's say if the perpetrator, if their girlfriend is the perpetrator and is kind of attacking, assaulting you in this way, or trying to overpower you psychologically speaking, and you don't want to be victimized by that assault, then you're not responding in that predictable way of having been impacted by this assault, but you are responding in a more literally, I would say, either mature and or even manipulative way, and or even more slick way. So there could be many ways to look at this and interpret this. We need a lot more information to really literally put our finger on the right answer, but certainly there are some notions in terms of a reactional, reactive, interactional power play in place. And or it can also have a lot of what we call transference, tinged type of quality, which is basically something you have grown up with in the past, it's familiar to you, you had to come up with a solution to survive around that type of a contempt and derision in your upbringing, and you naturally gravitate toward dealing with this in the moment in the best way you can in order to simply survive that relationship, survive that attack, survive that, let's say, criticism and possibly assault and contempt. So, and not be too burdened by it, and be able to overcome that situation and moment and continue moving on. So that's really all I can say at this time. I wish you could say more so I can tell you more about that. Sergio asks, and we are at 6 p.m., so we have 2 more questions. Let me see. I can really just literally get to one of them for a few minutes, as we started about 5-10 minutes late. And then we keep Natasha's question for next time, and after New Year. So Sergio asked, thanks for your help and time. You're welcome. Can someone have at the same time symptoms of BPD, borderline, and codependency? Yes, absolutely. Even though the concepts of BPD, borderline, or bipolar, I'm thinking that they're referring to. So can someone have borderline and bipolar? Generally, I would say yes. Technically, maybe no. This is a quite controversial and contested proposition that perhaps borderline and BPD are really one and the same. Even though there's some research that shows, for instance, borderline is a little bit different than bipolar. Bipolar has a lot more genetic and neurochemical components to it. So basically hormonal and neurochemical imbalances, even brain structure and chemistry and organization, neuronal organization, if you will, within the brain, and also genetic factors in terms of heredity versus borderline. So borderline doesn't necessarily have much evidence in terms of neurochemical imbalances as much as bipolar has. And also we see that medication, for instance, people with bipolar respond more readily to certain medication that are mood stabilizers versus borderlines that would be more effectively helped with antidepressants or actually SSRIs, but only for one aspect, a couple of aspects of their disorder. And then this at the same time symptoms of BPD. So could they have symptoms of either one of these plus codependency? Yes, and I mean again, codependency really is across the board, whether or not we have disorders, whether or not we have multiple disorders or just one disorder, and regardless of whatever disorder we have, codependency is more or less an aspect of the health of a boundary within relationships. And it's almost like a measurement of the quality of a person's ability to respect boundaries, appreciate, recognize, develop, maintain boundaries between oneself and the other, and irrespective of disorders and or even healthy functioning, people can engage in codependent interactions. So I hope I answered your question, Sergio. I'm just going to read Natasha's question. We could wrap it up within 5 minutes, hopefully. If not, then we will postpone it to next year, because it's now the end of December. So in a few days, it's going to be next year. So Natasha asked, I recently found out that I have BOD. BOD, I'm not sure what you mean by BOD. Maybe she mistyped BPD. BOD. Okay, and it makes sense why you got as angry as I did. I'm going through something traumatic right now, and I don't feel anything. How do I allow myself to feel the full extent of the situation instead of internalizing everything, which will lead to yet another burst of uncontrollable anger? So I'm guessing probably the BOD, the mistype, maybe it's more like a BPD, bipolar, borderline personality disorder, and perhaps that's why you are also referring to uncontrollable anger. If that's the case, so let me read it again. I recently found out that I have that, and it makes sense. I'm not going through something traumatic right now, and I don't feel anything. I see. How do I allow myself to feel the full? Okay, I see. So basically, the idea here is that the person is saying, like, at times I don't feel anything, and other times I have to go kind of to a burst of uncontrollable anger, because they have internalized everything rather than allowing themselves to actually feel the pain and walk through that pain, even though they may not have had traumatic upbringing or even a currently traumatic situation. So it's more really the hallmark of borderline personality in terms of that emotional dysregulation. It's a quite typical example of a person who is emotionally dysregulated, meaning they have a hard time with dealing with little, if you will, feelings of pain, whether it is disappointments, insults, etc. And they don't allow themselves to really feel that little pain, and they kind of bottle up everything or stay away from things until it's kind of uncontrollable. And then they go full force, so go from 0 to 60 in a second. And so that's a good comparison that you're making, Natasha. And I think the answer to this really is to what you mentioned, how to allow yourself to feel the little pains versus large pains, is to really practice that with DBT. And that's really a perfect solution for this type of a skill building. DBT, or dialectical behavioral therapy, as many centers nowadays have rigorous programs. They engage in 16-week or 4 months of training, taking place once or twice a week, and there have exercises, that where you practice on a weekly basis within a group setting, in terms of allowing yourself to realize, kind of grow those psychological muscles, in terms of feeling things, allowing it to happen, uh, building the muscle to deal with it, the psychological muscle to and skill basically to handle those little painful experiences, and being able to uh, level the intensity and bring it down to a manageable level. Okay, everyone, it's 6:10. I hope you enjoyed today's presentation and live discussion, really live monologue more than anything. But thank you for watching. I appreciate your patronage at Therapy Table, and we will continue after New Year. I believe it is the 4th of January 2018 at 5 p.m. Pacific Standard Time. I'm here to answer questions. Bring on your questions, bring on your friends, let everybody know. Let us promote the help around the world. And I'm here to help and answer your questions. I wish you a happy New Year and happy holidays. Take care of yourselves. And remember, more tolerance and more patience. Have a wonderful evening.